Hi, everybody, and sorry for the delay and keeping you waiting. My presentation is going to be quite brief. I am really glad that we have included pediatrics in this because very frequently in most other diseases, as well as in long COVID, pediatric tends to get left behind. And it was great to hear Danilo's talk as well. And I know that there are further talks scheduled as well. Okay, I have no major conflict of interest. I am a part of Recover, and I'm a hub PI at Children's Hospital Los Angeles, though what I'm presenting today is not part of Recover. So I think to this audience, I don't need to talk a lot about the background of long COVID, but we know that long COVID has been recognized as a long-term consequence of acute SARS-CoV-2 infection. It affects both adults and children. And recent reports have raised attention to the burden of long COVID in children. There are a wide range of symptoms, and lack of diagnostic tests, as we all know, has made it more difficult and a challenge to diagnose. And we know that it can present with a variety of physical, cognitive, and mood symptoms. And it describes a range of ongoing relapsing or new symptoms that continue to develop after acute COVID-19 and are not explained by an alternative diagnosis. Symptoms can last from weeks to months and fluctuate over time. And the symptoms significantly affect the quality of life. In many cases, the prognosis may be good, but some may develop persistent long-term symptoms. So the spectrum of long COVID, as discussed by other presenters as well, it really affects almost every organ system in the body. And that's very similar to what it is in adults. It affects all of the organ systems. And this is a picture which shows the very broad nature of the symptomatology. So there has been, so the initial focus has primarily been on adults and long COVID in adults. And for a very long time, there was actually denial that long COVID exists in children. I'm glad that situation has changed, and there is more and more a recognition of that long COVID does exist in children. But the next question is, even within children, there is a very broad developmental range. So does long COVID look the same in children of all ages? Probably not. And that is another area of study which has been taken up by Recover. And actually this is a Recover paper that was published recently in JAMA, which looked at two age groups, 6 to 11 years of age and 12 to 17. And found that, so if you look at this figure, the symptoms that are common between the two groups are in the middle. So there were 14 symptoms that were common in both of those age groups. But there were some symptoms which were different between the two age groups. And if you look at the adolescents, this has been actually found in quite a few studies that the ENT symptoms, especially the anosmia, dysgeusia, this is more likely to be seen in adolescents. And in younger children, and it may be because younger children are having trouble communicating, refusal to go to school, for example, may be a significant symptom that has to be recognized. And dermatological symptoms are also more common, likely to be seen in younger age group. So this definitely needs more study. I think we need to identify what long COVID looks like in children of different age groups. And so the under 0 to 5 age group paper is currently being written up, so we'll see that published soon as well. So this is part of Recover. I just wanted to highlight what's happening with pediatric studies currently. So primarily this talk, I'm going to be talking about the long COVID clinic at Children's Hospital Los Angeles. Early on in the pandemic, MIS-C was a very big thing that was recognized. There was a lot of recognition and attention to MIS-C. And all over the world, very quickly, diagnostic criteria came up. And pediatricians were generally comfortable diagnosing MIS-C. And we were in the similar situation. We saw a lot of patients with MIS-C. And we had an outpatient clinic to follow up MIS-C that was led by cardiologists. And we started getting referrals to this clinic with symptoms that were not messy, but that were symptoms that clearly started after the COVID-19 infection. And actually, Danilo presented a few cases. That's been exactly our experience. Patients who were doing very well academically and from an extracurricular perspective, good sports people, dancers, having this abrupt, severe change in their life. So it was at this point that the need for long COVID clinic was recognized. And eventually, in kind of discussing which division would house this long COVID clinic, eventually the ID division was where it started. I know that across the world there are different specialties which house ID, the long COVID clinic. So the way we do it is that the ID provider is the first to see the patient. They do a comprehensive evaluation, history, physical exam, and labs if needed. And from there on, referrals are done to the various subspecialists based on symptomatology. And for facilitating these referrals, we have past champions in various divisions who serve as the point of contact and facilitate these referrals. So if you see, this is more of a graphical representation of what I just said. Once the ID physician sees, these are the main specialties that we refer to. And of course, pain, social work, mental health, PT, and OT are integral parts of referrals that happen as well. Part of our clinic has been hampered by long wait times in all of these specialties. So I would say an ideal clinic, long COVID clinic, would have all these specialties at the same place. I know that some programs do operate like that, having a multidisciplinary team be available to the patient at their first visit. We do not have the resources to do that, but that would probably be something which would be a better system to see these patients. So what's known about long COVID in children? So some studies have evaluated long COVID, but there's not enough information about its course, symptom burden, and changes over time. In adults, we know that long COVID is more commonly seen in adult females. However, are there gender differences in children? That is not really very well known. And not much is known about the effects of vaccination on symptoms of long COVID in children. So these were the objectives that we set out to analyze. So we wanted to identify the symptoms of long COVID in children and identify gender differences, if any, to determine the overall symptom duration and course by addressing symptom burden over time and to observe the impact of vaccination. So the patients included in this study were all children referred to the COVID recovery clinic at Children's Hospital, Los Angeles. And what were the referrals were primarily from primary care pediatricians or by the families themselves. And what were the criteria for acceptance? Any patient who has had new symptoms that have lasted more than 4 weeks. So at the time we used the CDC NIH criteria, lasted more than 4 weeks, and having significant impact on their quality of life. As long as they met both of these criteria, they could be referred to our clinic. The age was 0 to 21 years, and the data used for this analysis was from August 2021 to May 2023. And primarily a retrospective chart review was used. So if you see here, 123 patients were included, and mean age was 13.1 years with a standard deviation of 3.9. 63 were males, so there was a nearly equal distribution between males and females. And the time of onset of long COVID symptoms from the initial infection was around 5 weeks. But again, there was a wide standard deviation of 13 weeks. And the mean duration of symptoms at presentation was actually 31.3 weeks. It just shows that the time for a child to get diagnosed with long COVID is just so incredibly long. And when I talked in the beginning, I said labs if we thought they were necessary. Usually by the time patients came to see us, they had seen sometimes upwards of 10 or 12 doctors and had extensive investigation testing done, most of which were normal. So the most common reported symptoms in our cohort, 93% of the patients had fatigue, 70% had headache. So these were the top 5 symptoms: exercise intolerance, dizziness, and brain fog. Again, quite similar to the symptoms seen in adults. The next question was, are there significant difference in symptom duration between males and females when they were first seen in clinic? So there was no significant difference in symptom duration. So both had similar number and duration of symptoms. But when we compared specific symptoms, there were particular symptoms that were more likely to be seen in females, which included dizziness, brain fog, palpitations, passing out, and a diagnosis of POTS. That was more likely to be seen in the female patients. And loss of appetite and loss of smell actually was more likely to be seen in the male patients. But the numbers in the loss of appetite group were quite small to make significant assumptions from this. The other thing we wanted to do was to see what happens to the symptoms burden over time. And this included patients who had at least one follow-up after they were seen in clinic, and represents 74 patients who had at least one follow-up. And from what you see here, overall, there is a trend towards decreasing symptom burden over time. And when we did the analysis, the symptom burden, mean symptom burden at diagnosis or at the presentation to clinic was 8.6. And in 6 months, it dropped somewhere around 6. And so there was a drop. I'll just show you the next slide. So this is the change in the number of symptoms over time.
Move towards conclusions for running over.
Sorry?
Can we move towards the conclusion slide?
Oh, are we short on time?
We're quite well over.
Okay.
Thank you.
Okay. So this was there was a decrease in the number of symptoms as time progressed, and if symptoms lasted beyond 10 months, I think the rate of decrease was lower. And this is the effect of vaccination. This is a meta-analysis, but I'll just go through the vaccination quickly. It's a couple of slides and then conclude.
One slide maybe.
Okay.
Afterwards. Yeah.
Okay, so vaccination, let's see, vaccinated and unvaccinated. There was no significant difference in the duration of symptoms, but when we look at children who got vaccinated after the onset of COVID, after the onset of long COVID. So this is that part which talks about therapeutic vaccination. You'll see that 44% of the patients showed improvement in symptoms. So this is something that definitely needs further study. Okay, all right. So I think I went through most of this. The symptoms that we talked about in children. Vaccination appears to have a beneficial effect in alleviating long COVID symptoms, and larger studies with longer prospective follow-ups are needed. That is it. Thank you.
Thank you.